BusyBox's expert information on keloid scars. What are keloid scars?
Keloid scars are like tumor-like growth of the proliferation of the connective tissue cells when the skin is trying to heal following a cut or a nick in your skin.
What do keloid scars look like?
In early stages, they look more red and slightly raised from the skin, and as they grow older, they look more darker and tumor-like in appearance.
What causes keloid scars?
The exact cause for keloid scars is unknown, but one of the main reasons is the abnormal growth of these connective tissue cells trying to fill that scar into the skin, and it just continues to grow unchecked and tends to grow out of the skin and then looks tumor-like on the skin.
Who is most susceptible to keloid scars?
The people who are most susceptible to keloid scar are the people who've got more pigment in their skin. So the risk increases towards the darker skin type and obviously lesser towards the more whiter skin types.
Where are keloid scars most likely to appear?
Keloid scars have a tendency to affect more areas than others. The most common areas are in the center of your chest, and then the frequency reduces from the neck to face to shoulders and then your limbs.
How do keloid and hypertrophic scars differ?
The basic difference between the keloid scar and a hypertrophic scar is the way they look. The hypertrophic scars are normally following a little cut in your skin or minor surgery, and there is a limitation to the growth. So it's normally confines to the limitation of to the limits of the scar, and normally follows the shape of the scar, whereas a keloid scar could grow out of proportion, and it doesn't necessarily need any cut or incision in your skin in first place.
Can I prevent keloid scars?
You do have a predisposition to keloid scar. There are things you can try to prevent it. If you do have a little cut or a nick, not to irritate it further and just look after it. If it is following a surgical procedure, then there are ways we can try to reduce that.
How are keloid scars treated?
Keloid scars can be treated in various different ways, which ranges from some pressure dressings to steroid injections to excision of the scar and to some laser treatments.
Are keloid scars completely removed with treatment?
There is no perfect treatment for keloid scars, so you're always likely to have some sort of a change in the texture of the skin, and you're not likely to get a normal skin there. All these treatments have efficacy to a certain degree. For example, steroid injections are good in terms of flattening them out, and so they don't look as raised as long as they're not big enough. The excision by surgery gets rid of it, but there is a high chance of those coming back again.
What results can I expect?
Most cases you can expect the scars to be significantly reduced in the size with a very high chance of going flat completely. There are newer machines and lasers these days which can then further try to improve and change the skin color close to the surrounding skin.
Are the results permanent?
Because we know the basis of keloid scar is the abnormal growth of cells inside, so yes, there is always a risk of them growing back again because slightest of irritation can activate this procedure later in your life.
Who can perform keloid scar treatment?
Keloid scar treatment should be performed by a registered doctor experienced in dealing with keloid scars and all the procedures.
How much does keloid scar treatment usually cost?
The cost of steroid injection starts from £175 per injection, and you will need to have a series of injections depending upon the severity of it. The average time between the two injections varies from 2 to 4 weeks.
www.busybox.com